How is pulse pressure related to isolated systolic hypertension? Have you ever wondered how pulse pressure connects to isolated systolic hypertension? Let's break it down in a simple way. Pulse pressure is the difference between systolic blood pressure, which is the top number, and diastolic blood pressure, the bottom number. In isolated systolic hypertension, the systolic pressure is higher while the diastolic pressure stays normal or even low. This creates a wider pulse pressure. This wider pulse pressure is a key aspect of isolated systolic hypertension. It shows changes happening in the large arteries, especially the aorta. As people age, the aorta and other large arteries can become stiffer. This stiffness often comes from a condition called atherosclerosis, which is the buildup of fats and cholesterol in the arteries. When these arteries lose their elasticity, they cannot expand as easily when the heart pumps blood. This leads to higher systolic pressure and lower diastolic pressure, resulting in an increased pulse pressure. Now, why is this important? A wider pulse pressure is not just a number. It serves as an important marker of cardiovascular risk. Research shows that a larger pulse pressure indicates greater arterial stiffness. This can independently predict serious cardiovascular issues like strokes, heart attacks, and even death, particularly in older adults with isolated systolic hypertension. The stiff arteries cause pressure waves to return to the heart sooner during systole, which raises systolic pressure even more and lowers diastolic pressure. This can compromise blood flow to the heart and brain. So, how do we manage this? Monitoring pulse pressure in individuals with isolated systolic hypertension is essential. Keeping an eye on this measurement can help reduce the risk of serious cardiovascular events. Treatments that aim to lower systolic pressure can also help decrease pulse pressure, leading to better health outcomes. In summary, pulse pressure is closely related to isolated systolic hypertension. The widening of pulse pressure is a result of arterial stiffness that raises systolic pressure while lowering diastolic pressure. Understanding this relationship is key to managing health and reducing cardiovascular risks.